This is a NBC 25 News special report.
Obamacare, the Affordable Care Act, healthcare reform. No matter which name it goes by, some major changes are in store for the way you and your family receive healthcare.
The changes are aimed at making it easier for millions of currently uninsured Michigan residents to receive health insurance.
It's the biggest change in the healthcare industry in nearly half a century. The new law remains controversial and, to many, confusing.
In the next 30 minutes, our panel of experts will help explain the changes that are coming and answer your questions about this medical makeover.
Live from NBC 25 News, this is Medical Makeover, You and Healthcare Reform. Here are your hosts, Bill Harris and Jane Park.
Thank you and good evening, everyone. I am Bill Harris.
And I'm Jane Park. Thanks for joining us tonight. Starting next year, every American will be required to have health insurance. And in mere days, new healthcare exchanges will open to help people sign up for new insurance plans.
Tonight, NBC 25 News has assembled a team of experts in the healthcare field. They will help explain the changes that are coming and give you important information about how to select the best options for you and your family. So what exactly is the Affordable Care Act? Well, the law will expand health care benefits to nearly 55 million Americans who currently do not have health coverage and millions more who have partial coverage. The new law prevents insurers from dropping your coverage, raising your premiums if you get sick, or denying you coverage if you have a pre-existing condition. It also limits the yearly amount you pay for medical expenses. More people will be eligible for Medicaid insurance for the poor, and there is a financial assistance plan available to help many people purchase health insurance from newly created health care exchanges. The experts say the Affordable Care Act should increase the options available for people who are not currently covered by an insurance plan offered by their employer.
This is an opportunity for everyone to receive coverage and also to potentially receive different subsidies. Premium credits, cost reductions.
There are several organizations right here in mid-Michigan that are closely watching developments when it comes to the new health care law. The Genesee, Saginaw, and Bay health plans provide programs that offer basic health care services in our area. Saginaw Bay Underwriters is a full-service insurance agency that works with companies to provide health insurance benefits for their employees, and Yo and Yo's accountants help people and businesses understand the tax-related and record-keeping requirements under the new law. We've assembled them in our newsroom, and they are available to answer your questions. For the next half hour, you can reach our panel by calling toll-free 1-888-939-4025. You can send an email to medicalmakeover@nbc25.net, and we'll also take questions on Facebook and through Twitter by using the hashtag medicalmakeover. We'll try to answer some of your questions live on the air later in the show.
Well, one of the biggest changes with the new health care law is affecting Medicaid. Governor Rick Snyder signing legislation on Monday will make more Michigan residents eligible for the government-paid health care for the poor.
Ahead, you'll meet some of the people who will see new medical benefits. That's next on Medical Makeover.
Welcome back to Medical Makeover, an NBC 25 News special. One of the new rules under the new healthcare law affects children. They can remain covered by their parents' health plan up to 26 years of age. Jane?
All right, thanks, Bill. Well, Michigan ranks near the top of all states when it comes to the number of people who don't have health insurance. Currently, Michigan has 1.8 million people who are uninsured. The state legislature recently approved expanding Medicaid, which could cover 470,000 more people. The law's change will provide health insurance for an individual making up to $15,860 a year, or nearly $27,000 for a family of three. Meet one Saginaw Township couple who knows the importance of this program. Amy Fowler gets her prescriptions filled every 3 months. She's on medications for diabetes and high blood pressure, and also sees a doctor for her glaucoma. Right now, those costs are covered by the Saginaw Health Plan, which offers basic health services to the uninsured.
Without this, I don't know what we would do.
Amy and her husband Tom are two of more than 19,000 people in Saginaw County living without health insurance. Amy is recently unemployed. Tom is retired. Virtually no health plan is affordable for the couple.
We're not the type to want to have handouts, but health insurance is very important.
When the Medicaid expansion bill takes effect next spring, Amy and Tom will likely be among 470,000 Michigan residents newly eligible for the low-cost plan. They'll have access to primary care, hospitalizations, and preventive care.
It takes a big, relief off of you.
And that peace of mind, the Fowlers say, is priceless.
For the people that are low income, this is a great opportunity for us to be able to have, the proper medical care and, everything else that goes along with it.
Under the new bill signed by Governor Snyder this week, the Medicaid expansion will take effect next spring.
Well, we're live at the phone bank right now, and one of the phone bankers, if you want to call that, is Jeff Sams from Saginaw Bay Underwriters. We're taking your phone calls. We're happy to say the phones are really lighting up. Jeff, the first question is health care insurance on the exchange. Hearing a lot of talk about the exchange. Is it less expensive insurance than my employer's plan?
Well, the actual cost net to the person purchasing the insurance will be less because of if they're eligible for subsidies or credits, then they will be paying less. The actual premium would be similar to what it would be to purchase a plan. But again, the net cost, if someone is getting a credit or a subsidy, might be less for them.
Now, we're hearing a lot of things about things are going to be postponed. When we're hearing about sign up in October and January, a lot of dates, but there are certain things that are going to be postponed as well.
Correct. All the employer mandates, that the pay or play rules, where employers were going to be penalized for either not offering health insurance or not offering affordable health insurance, have been postponed for 1 year. Some of the things that haven't been postponed would be the issue of employees must become eligible for their plan within 90 days of hire. Many of our employers used to allow it to be the first of the month following 90 days. So those are things that are changing, and there's other provisions that are also staying the same.
Oh, very good, Jeff. I'll let you take your seat back so you can go answer the phones. You can reach our panel by calling our toll-free number, 1-888-939-4025. And we're also taking your questions through email, through Facebook and Twitter, using the information you see on your screen. Jeff, Jane?
All right, thanks, Bill. Well, under the new health care law, companies could face penalties if they don't offer insurance to their employees. Coming up next, we'll talk with local businesses who are navigating the requirements. You're watching Medical Makeover on NBC 25. Welcome back to Medical Makeover. Under the new health care law, insurance plans won't be able to charge you more than $6,400 for medical expenses each year. Families will be capped at $12,800. Bill?
Among the expected effects of health care reform to the business community, new health care coverage costs, a mandate for certain employers to provide health insurance or pay a penalty, and new taxes. But while the actual effects will vary from business to business, one thing remains constant, at least for now: there are a lot of questions.
From large financial institutions to small family-owned restaurants, healthcare reform is having an impact on the way local businesses will be conducting business.
It's affecting us much greater than we had anticipated.
The little guys like myself are just we're just waiting for what's going to happen.
Chris Polis is co-owner of the White Horse Tavern on Flint's West Side, a family-owned business celebrating its 40th year in the community.
I don't believe I am going to be affected as an employer, Chris Polis, employer at the White Horse, because I fall under the threshold of 50 people.
But while falling under that reform threshold with a staff of 17, the owners of the White Horse say they still have a responsibility to their staff.
I have to figure out how to do something to help them, because they have to pay something, do something, or face a fine or a penalty of some sort. And again, nobody knows what that's going to be.
The questions, frustration, and confusion associated with healthcare reform are not just limited to the small business owner. Across town at the Burton headquarters of Elga Credit Union, management and employees are also searching for answers.
Well, I think there's a lot of confusion around it right now. So the sense is, just tell me what it's going to look like, what's it going to cost us, and am I going to have the same coverage I've always had?
Questions and confusion aside, Elga employees and management are already realizing one certain ripple effect of healthcare reform. For the first time in their 62-year history, Elga is now forced to turn to their employees for help.
They're getting a copay that they never had before, or an increase of what they had.
We're going to do what we have to do and go from there.
Well, Chris and Karen both agree on one thing. Karen says confusion seems to be the word of the day, while Chris says we really just don't know what's going to happen. Jane?
All right, thanks, Bill. We're live at the phone bank where a panel of experts have been busy answering your questions. We are joined right now by Linda Hamaker of Genesee, Saginaw, and Bay County Health Plans. Linda, we had to pull you from the phones there, but the first question I have for you is, if I am 70 years old and I'm on Medicare, what changes take effect for me?
Well, Medicare begins at age 65, and Medicare beneficiaries are actually going to get some enhancement to their benefit. They'll be paying less for prescription medications, and they're going to have preventive services now that are covered. But they don't need to do anything. All that will happen automatically. They don't need to take action to sign up for anything. They certainly shouldn't pay anyone or give any personal information about anything. They're all set and they can just sit back and relax.
Sure. Our second question, how can I afford the new health insurance options?
Well, the new health insurance options, first of all, many people will be eligible for Medicaid. An individual, up to just under $16,000 now will be eligible to enroll in Medicaid. And then beyond that income, people will receive a premium subsidy that will help them pay for their health coverage, and it's based on income. So what you pay is based strictly on your income, so it is affordable for everyone.
So that is good news. Thank you, Linda. And you can reach our panel by calling toll-free 1-888-939-4025. We're also taking your questions through email, through Facebook and Twitter using the information you see on your screen. Bill?
Next question, so what if you do not qualify for Medicaid or you don't have a job that offers insurance? There's a new option for you and the many people who work for themselves. We'll tell you about the healthcare exchanges. That's next on Medical Makeover, right here on NBC 25.
And welcome back, everyone. You're watching Medical Makeover, an NBC 25 news special. Now, under the new healthcare law, insurance plans will have to cover everything from doctor and hospital visits, prescription drugs, mental health services, and preventive and wellness care. And you can find out more about these essential health benefits online at mynbcnews.com. Back to the studio with Jane.
All right, thanks, Bill. The Burton man you're about to meet is an assistant golf professional. He's been uninsured for years because his job doesn't offer health care. Well, come October, he'll be one of the many people using the healthcare exchange to buy insurance online. Scott Klink has lived without health insurance his entire adult life. His job doesn't offer it, and he can't afford it on his own.
You just live without health insurance and hope nothing else goes bad.
But one morning 8 years ago, Scott woke up and noticed he couldn't see out of one of his eyes. He went to a nearby clinic that introduced him to Genesee Health Plan, a county-funded program that provides basic health care services to the uninsured. Scott was diagnosed with diabetes and high blood pressure.
I was 300 pounds and 50 years old. I saw what was going to happen if I didn't take charge of my health.
Over the last 2.5 years, Scott lost 115 pounds and is now off 4 of his medications. No longer considered diabetic, Scott is eagerly awaiting for a second small victory to finally enroll in a health care plan he can afford.
It's very exciting.
Scott will be able to shop online for insurance through Michigan's healthcare exchange, where more than a dozen insurance companies will be competing for business. And Scott can choose a plan that fits his income and desired level of coverage.
The tools are there for every American to be able to see a doctor now.
It is a message the Genesee Health Plan is working to get out to the roughly 22,000 people it serves.
One of the things that this does is it makes it easier for people to look at what their health care options are.
Jim Milanowski says while some of the uninsured will be able to enroll in Medicaid, others like Scott will be able to buy subsidized insurance through the exchange, full coverage that includes emergency room visits and hospitalization.
Living without health insurance is a tremendous stress.
And for Scott, that means he can continue his journey to better health, knowing he's covered. Uninsured adults making between $15,000 and $45,000 a year would likely be eligible for a subsidized health care plan through the exchange. According to the latest census figures, that amounts to roughly 35,000 uninsured people across Genesee, Saginaw, and Bay counties. Bill?
Back at the phone bank right now, and the phones are really, really busy. It's indicative of how much confused people are and how many questions they have. Matter of fact, the guy who was supposed to be interviewing this segment is still on the phone, so we'll try and catch up in the next segment. But right now, we're talking to
Cindy Menino from Saginaw Health Plan.
Cindy, your phones have been lighting up. What are some of the questions you're getting?
People are just really concerned about how they're going to be able to afford it, where they will go for trusted information on the exchanges, and basically what's going to happen if they can't pay for it.
What are some of the responses? I mean, are you giving, the callers resources, where to go, things like that?
I am, and actually I've had very positive response. They're very grateful. They're very appreciative of this call-in program.
Research has indicated up to this point that really, now that it's on our doorstep, people haven't really bought into it yet. They didn't have a clear understanding. Now things are slowly coming into focus?
I would agree with that. I think that they just are concerned about where to go for trusted information. So they're grateful that we're giving them resources, 1-800 numbers to call and get scheduled with counselors, as well as the websites to find the information.
Very good. You got a call holding. We'll let you get back to it. Thank you so much. Our phone bank is going to close pretty soon right now. Here's your last chance to get questions answered by our experts. You can call toll-free 1-888-939-4025 or send your questions by email and through Facebook and Twitter using the information you see on the screen right now. Jane, back to you.
The government wants everyone to get health insurance, and most people will face penalties if they don't. Starting next year, the fee will be $95 or 1% of income, whichever is greater. That amount rises every year until 2016. Then the fee will be $695 or 2.5% of income. Stay tuned. This NBC 25 News special, Medical Makeover, continues after this. Bill and I will be right back. Welcome back. The Better Business Bureau says there are companies that are taking advantage of people by selling you high-priced insurance plans or stealing your personal information. Well, here are some tips to make sure you don't get ripped off. First, go to people you trust, like your doctor and family friends. Certified healthcare navigators and application counselors can also give referrals for health insurance plans. Never pay someone to help enroll you in new insurance options. Never give personal information over the phone, and always ask to see if all of your options. And while there are a lot of options out there, there's also a lot of help available to help you navigate the new healthcare law.
As we're evidence tonight, a lot of people are looking for help, looking to get their questions answered. Lawmakers on Capitol Hill continue to debate, meantime, some aspects of the healthcare reform. Most experts say you will need to take steps now to prepare you and your family for the changes that are coming.
Open enrollment for the new healthcare exchanges is expected to begin on October 1st for anyone not covered by Medicaid or a company-provided health plan. Then starting January 1st, new rules kick in that outline covered procedures, caps on the amount you will pay yearly, and prevents you from losing health insurance or having your premiums raised if you get sick. However, some mandates that involve companies with 50 or more full-time employees have been delayed until 2015 to give them time to comply with the new rules.
Okay, here's where you can get some information now. Any new developments in healthcare reform, we've created a special website that will include the latest news and helpful resources for you to learn how the changes will affect the healthcare that you and your family receive. You just go to mynbcnews.com/medical makeover.
And Bill, I think just this whole show has given us just a clue of how many resources there are out there in our area.
I know, I've learned a lot.
Me too. We'd like to thank our sponsors who've been answering your questions all evening: Yo and Yo, Saginaw Bay Underwriters, and Genesee, Saginaw, and Bay Health Plans.
And on behalf of the entire NBC 25 News team, thank you for tuning in tonight, and have a good evening.